Great. Thank you. I want to thank Edgardo Munoz, producer of our Zoom Facebook Live. Thank you so much. Welcome everyone. Um, good seeing everyone, and good to be always collaborating with esteemed colleagues in Tucson who I respect a lot for the work they do day in and day out to work with in the areas of public health and work with vulnerable population. My name is Eladio Pereira. I'm the Chief Medical Officer here at the Mariposa Community Health Center in Nogales, and with me are my esteemed colleagues, Dr. Theresa Cullen and Dr. Lisa Soltani. Welcome.
Happy to be here. Thank you for inviting us.
Thank you.
And I didn't mention Dr. Cullen works at the Pima County Health Department, the director, and Dr. Lisa Soltani works at a Real Health in Tucson. They do just a tremendous amount of work, and I want to thank both of them for the work they do. I'm very grateful to work with you and learn from you. And Dr. Soltani and Dr. Cullen have been just tremendous in terms of really sending out the message and the importance of high blood pressure and treating high blood pressure to prevent illness. But the first question would be for Dr. Soltani. What is high blood pressure? I know there are two numbers that we frequently talk about, the upper, like my patient said, the upper number and the lower number. And so what is high blood pressure, Dr. Soltani?
I think that's such a great question to start with. And I think it has become confusing sometimes for people because a lot of different numbers are mentioned about things that we pay attention to. But and we used to say, well, if you're older or maybe sometimes it's okay to have high blood pressure above certain numbers, but we've really come to learn that tight blood pressure control, bringing it under certain thresholds and consistently keeping it there will keep us healthier for longer and prevent many of the diseases that sadly take the lives of Americans before their time. And we can prevent that from happening if we can really control blood pressure well. So in general, a normal blood pressure, we'd like to see people consistently 120 over 80 or less, as much as possible. Once we get to a blood pressure that is above 130 over 80, that's when we start to say to people, your blood pressure is too high. So those numbers are maybe lower than what some people have been used to hearing in the past, but really over the last 5 to 10 years, we've settled on that lower threshold, less than 130 over 80 whenever possible. And we know that the evidence tells us that people have stronger hearts, better kidney function, and less risk for stroke when we keep people below those numbers. So thank you so much for asking about that.
And really, the only way of determining that is actually by measuring blood pressure. You have to measure it. Before we began our talk, we are just talking about symptoms. Measuring is the best way because if we depend on symptoms, we're not going to make the right diagnosis. And Dr. Soltani mentioned to us the fact that there was a recent survey looking at the perception of symptoms. Can you review that for us?
Yes, that's exactly right. And many of our viewers may have heard about this because I think it made the news cycles and it was reported on in U.S. News and World Report and maybe even USA Today. But there was a big survey of Americans from the Annenberg School last week, I believe it came out. And really, it was questioning Americans about what their understanding is about high blood pressure. And one is that people probably incorrectly identified that it's okay to have higher numbers than what we really talked about just now. The other misperception or misunderstanding is that many people still believe that if your blood pressure is high, you will have symptoms, meaning that you can just wait until you're having symptoms of high blood pressure before you need to worry about it. And maybe 1 in 3 people incorrectly believe that. So I think it's important for us to talk about how most of the time people do not have symptoms when their blood pressure is elevated. That if we wait for people to have symptoms from high blood pressure, like headache or chest pain or shortness of breath or dizziness, then we're waiting too long and we're allowing damage to happen that we could prevent. So as you pointed out, the best way to know whether your blood pressure is high or whether your blood pressure is controlled is to have it measured. With your doctor is great. At the health department is wonderful. Sometimes in pharmacies and at the health department, we have ways for people to get their blood pressure checked. But also, really, one of the great advances that we've had in medicine is that people can now purchase a blood pressure monitor from pharmacies often and even online that we know work well. So there is a list of blood pressure monitors that the American Heart Association has published online, and anyone can go to the internet and look that up. It's not behind a paywall. People can look and see what blood pressure monitors have been tested by the American Heart Association and have been found to be accurate. And many of these blood pressure monitors are easy to use. It's a cuff that slips right over your arm. It's a Velcro. You don't have to have a stethoscope or any of those where you have to listen. It's connected to a monitor that's an electronic monitor with a cord, and you simply press a button and you'll get a readout of your blood pressure, the top number, which is systolic, the bottom number, which is diastolic, and your heart rate. And then most of these machines also have a memory, so you don't have to try to write down all those numbers. You can simply bring your monitor to your doctor's appointments, and your doctor, your primary care provider, nurse practitioner can flip through those numbers and just make sure that that blood pressure is running great. We don't think that it's enough just to check blood pressure, at your once a year physical with your provider. That probably doesn't give us a good picture of what's happening day in and day out in your body. And that's why it's so wonderful if people can get a blood pressure monitor. If you're not sure, which monitor is good or how to use it, your provider can absolutely help you with that. And at the health department, we can also, help you, give you some support and where to find those monitors and how to use them. So thank you for asking that.
No, that's a great summary of where we stand. Dr. Cullen, we know that high blood pressure has significant public health um, consequences.
Right.
There are certain complications that we know about when blood pressure is either not treated or not treated adequately. And it has a lot of public health issues. Can you review that from your point of view? What
Yeah.
those issues are?
Yeah, thank you. I also want to echo what Dr. Soltani just shared. However, we used to have a phrase, know your number. So you should know your number. And if you don't know your number, you need to figure out what it is by getting screened. And you can either do it through what Dr. Soltani recommended, through a home cuff, which you could probably borrow from one of your friends if you don't have one, or by going into multiple places to get your blood pressure checked. The reason why that is so important from a public health perspective is because of the potentially deadly consequences of high blood pressure that is untreated. What we see in southern Arizona is a very high incidence of coronary disease. That's heart disease. That heart disease is almost always part of what contributes to it is uncontrolled high blood pressure. So people have elevated blood pressure, and for one or another reason, it either hasn't been treated or it hasn't been adequately controlled. When you have that, you can have heart attacks, you can have heart disease, you can have strokes with significant impact of you. You can have kidney disease, what we would call renal disease, and you can have lots of other complications. The most important thing for us is trying to decrease the incidence of heart disease in southern Arizona. And because we know that high blood pressure is a major contribution to that, we strongly encourage that people get screened. Our community health workers are all trained in how to screen blood pressure. And the reason why they are is we want no missed opportunities. We don't want any moment when you are encountering someone from the health department or from your primary care provider or from the pharmacy where you cannot get your blood pressure checked. Getting your blood pressure checked is critical. Obviously, the next step is making sure if it's elevated, you get into appropriate care and get treated. But from a public health perspective, if we can contribute to controlling blood pressure, we can decrease the loss of life, the loss of function, which happens with strokes or heart attacks, and we can work to get a healthier all of Southern Arizona together.
Yeah, I mean, it's still tragic that from time to time we'll see patients whose first presentation
Right.
of hypertension is a stroke or dialysis.
Yeah.
So that still happens, right? Or heart disease. And
Especially,
a lot of that work comes from having a doctor or a nurse
yeah,
practitioner, a PA that can see them. And so I know we work hard on that to make sure we expand access to care. But the first stop is to make sure they get screened, like you said, either in a way that Dr. Soltani and Dr. Cullen describe, or seeing your doctor in the office, right?
right. And I just think it's important for people to know that you don't have to have that stroke. You don't have to have that heart attack. You
Right.
can live a long, you don't have to have that dialysis.
Yeah.
Even if it seems like you're at risk because of your family, you can prevent that. You can work with your primary care provider, with the healthcare system to make sure that doesn't happen.
Yeah. Well said. And we were talking to Dr. Soltani earlier, and despite those efforts, sometimes the study don't show that we're doing a lot better.
Right.
And now, Dr. Soltani, can you describe that recent study that look at blood pressure control as
Yes.
well?
Yes, and really, I think it's a good news, bad news situation that the good news is that for many decades in the United States, we were doing each time it was measured, we were doing a better job controlling high blood pressure. So now we have a number of very effective medications. We have these home blood pressure monitors that are relatively affordable. People have started to really understand that if they don't smoke cigarettes, if they try to reduce the amount of processed foods and fast foods, if they reduce the amount of sodium that they put in their foods, if they get, even a little bit of exercise, that through all of these different ways, not just medication, but all the lifestyle ways that we have, all of the self-monitoring, really a lot of that allowed people to get better blood pressure control for many years in the United States. Our blood pressure control, each time it was measured, was getting better. Something happened in the late teens, so 2017, 2018, up through 2020, where instead of getting better blood pressure control in the United States as a whole, we had a bit of a setback. And then COVID happened and life got very stressful and complicated. And this last time that we looked across the United States to say, okay, how many people have high blood pressure? How many people know about their high blood pressure? And how many people have that blood pressure well controlled? Those numbers, unfortunately, have not improved, but at the very least, they've not gotten worse. So it looks like we're stabilizing. And again, we have so many promising and effective treatments now for high blood pressure, and really efforts like ours today to try to help to educate people, to not just think, okay, I'm probably okay, but instead really go out and investigate and get that blood pressure checked. That, I'm very hopeful, and I think many other doctors and scientists in this country are very hopeful that we're going to turn this around and get, much better blood pressure control again. And one thing I wanted to mention is, thanks very much to Dr. Cullen and the Pima County Health Department, but you can even go and check out a blood pressure monitor, very similar to this one that I've been showing, at any library. So any Pima County library system, if you have a library card, just like you can walk in and check out a book, you can walk in and check out a monitor that you can take home and really spend, several days or weeks even checking your blood pressure regularly to kind of see what your average is running. So, I think there's some good news here as well.
Thank you for sharing that, and thank you for sharing the ability or the availability of resources to screen for high blood pressure. Many of our patients believe that medication is always needed, and many times it is. But there are some things that can be done that are what we call non-pharmacologic therapy. Dr. Cullen, can you review briefly some of those things that we can do to help ourselves without the need for medication?
Yeah, I'd love to because it's part of making a healthy community, right? A healthy environment, a healthy community. From a public health perspective, a lot of what we focus on is prevention, right? So ideally, we would like you to not have high blood pressure. There's things you can do that will also control your blood pressure if it's elevated, but can help you prevent that. And Dr. Soltani talked about some of these. Smoking, whether it's vaping or cigarettes, definitely raise your blood pressure. If you are a smoker, you probably know that, just the way the tobacco makes you feel. So cutting back or stopping smoking totally is really a goal we would give to people. Moving, moving. And I know it's going to be very hot out there for the next 10 days. So moving early in the morning or after the sun goes down, or even where you work or where you live, just remember to get up and down from your chair and move regularly is really important. Watching what you eat, decreasing your salt intake. So if you're like me, you may want to grab for that salt shaker and try not to do that. Put that salt shaker away somewhere where you don't have access to it. Eating a healthy diet. And sometimes that can be difficult, but what we know is that fruits and vegetables, the more your plate is full of colors, that's usually what we say to people. So if you can't remember exactly what to do, just make sure you have colors, you have greens, you have oranges, you have reds on your plate. You're more likely to be eating a healthy diet that way. So those are really the major things. The combination of them is the most important. And I think what we know is it's hard to change. So if none of those things are part of what you're doing right now, it's probably best to pick one or two of them and start integrating that into your healthy lifestyle. And remember, your healthy lifestyle doesn't just prevent blood pressure problems. It can prevent diabetes. It can prevent you from becoming overweight. It can really let you move your body. You might not have those aches and pains that you've been having in your joints because you're moving more, eating healthier, stopping tobacco, not eating a lot of salt.
Right. No, that's a great summary. And Dr. Sultani, some of those interventions can be quite effective. Some of them drop blood pressure 3 to 5 millimeters of mercury, some even more. It can be sometimes up to 9, 10. So it's worth doing those because you may have a slight elevation of blood pressure, and don't those will get it back to normal, right?
That's right. Yeah, we've really been surprised, I think, that how effective lifestyle change can be in improving blood pressure, that many of these strategies that Dr. Cullen mentioned may be just as effective as a single blood pressure medication. So I want to be careful not to say that you're not going to need medication if you do these things, but it is clear that your blood pressure is going to be much more easy to control if you are eliminating or reducing sodium. There was, for many years, there's been a diet that maybe people have heard about that's called the DASH diet, and that stands for Dietary Approaches to Stop Hypertension. You can look that up on the internet and you can see what kinds of meals and what kinds of ingredients really fall under this DASH category. And yes, there's a very strict version of that diet that I think is probably very difficult for most people in their day-to-day to follow completely to the letter. But again, there was pretty recently a study that came out that said that even if you followed some part of the diet, that you didn't have to be so strict on the diet, but even kind of a modest attempt at following the DASH diet had really significant improvement in blood pressure. So hopefully your listeners will have a chance to look online and see what that DASH diet includes. It's really a lot of what Dr. Cullen mentioned: fresh fruits and vegetables, what we call complex grains. So those would be things like, whole grain rices, and lean meats, and minimizing red meats, and minimizing alcohol. Those kinds of diets, really trying as hard as you can to avoid processed foods. It's very, very hard to reduce your salt intake when you're eating processed foods. And I know it's hard because processed foods are the ones that are most readily available. So just really trying to explore in your environment, what are things that you could do so that when you're starving, you have something healthy to reach for. That might be unsalted almonds. There's some all kinds of different options. And I know that the Pima County Health Department has a whole website devoted to heart healthy habits. And there's some really great recommendations on that website too about what kinds of things people can snack on and other kinds of lifestyle changes that people can work on.
And while we're offering some general guidance, these decisions will be made with your healthcare provider.
Absolutely.
He or she will meet with you, review your measurements, create a treatment plan that may include the things we just mentioned. But medication is frequently needed, and certainly medication will lower the risk of those complications we spoke about, including stroke, heart attacks, and kidney failure. And finally, medication. Dr. Soltani is a very important piece of this. A number of options. I think what we hear sometimes from patients is the side effects, but now we have alternatives. So if we begin X drug and we see an adverse effect that is not sustainable, for example, we'll change it. We see sometimes when we start someone on an ACE inhibitor or something like lisinopril, they have a cough that doesn't go away. We're able to make some changes. So can you review with us briefly what those options might be and what are the indications maybe to use two medications or more for some patients?
Yeah, so that's a really great question. And I think, for a long time, maybe doctors were not sympathetic enough with people, or made enough space for people to really be able to talk about their concerns or their potential side effects that they're having. So one is, I just really hope that, and really want to invite our listeners to be honest with your primary care provider. They want the best for you. So if there's something about your medication that's making you feel unwell, please let us know. We can make adjustments. We have many options available to us. So let us know so we can talk you through it. But I think, the truth of the matter, if we're going to be honest, is that by the time we're needing medications to control blood pressure, so once your blood pressure is 140/90 or above, once you've reached that level of elevation, really, it's very likely that you're going to need a medication to bring it down, or at least a medication to bridge you while you're working on all of those lifestyle changes. And those things take time to turn blood pressure around. So we will want to offer you medication in the meantime to keep you safe. And it's become clear that probably we need more than one kind of medication to keep blood pressure under control. There are many avenues in our body that cause the blood pressure to rise. And because of that, we need more than one way to approach it to bring that blood pressure down. So one strategy that we've started to take is to give a combination medication. So it's one pill. It doesn't feel like a lot of medications. It's one pill, but in that one pill, there may be 2 or 3 different medications combined that work together from a different pathway to bring that blood pressure down. And when we do that, what we notice is that we're able to give people overall lower dose of those medications because it's in a combination pill. And when we give people a lower dose of a chemical, we're much less likely to cause them side effects. So we get the benefit of that route of blocking blood pressure without overwhelming people with either side effects or too many pills that they have to remember to take. So we have some really great strategies. I want people to have some confidence in that, but also really I want to invite people to be honest about what they're experiencing. It's your body. You have the right to feel good in it. So please let us know how we can help with that. And, we've talked a lot about how you should be seeing your primary care provider and follow up with your primary care provider. But I also want to be, honest that we understand some people don't have a primary care provider. And, it's not that easy sometimes to get a primary care provider. There are probably not enough primary care providers for all the people who need them. So if you find yourself without access to a primary care provider, again, thank you very much to Dr. Cullen, but the health department clinics have a way for you to be able to go and get your blood pressure checked. And if you really mention, hey, I'm worried about my blood pressure, it's not under control, but I don't have a doctor, I don't have a primary care provider, Dr. Cullen's team will help to connect you with a doctor at El Rio, a doctor at Mariposa, a doctor at Marana. Many of our community health centers here in Southern Arizona have made a commitment to be able to address high blood pressure. We know how important that is. So, that would be one route where you could get connected to care with us, and we'd be glad to see you.
Thank you for that summary. And I'd like to have Dr. Cullen review what resources Pima County offers for those patients. If you could summarize that for us, that would be great.
Yeah, Dr. Soltani always does a great job about talking about everything we have available. So first off, what we have isn't just for residents of Pima County. I mean, obviously we're focused in Pima County. We have 3 clinics here and we do a lot of mobile services at our schools and in the community with our vulnerable populations. But if you don't live in Pima County, you can still come get checked here. So if you go to our website, we have a lot of information about heart health there. A lot of it is what we call downloadable. That means that you can click it and it can get onto your phone or you can print it off your computer. We do screen everyone that comes in for high blood pressure. We ask them lots of other questions too to make sure that they're healthy, but screening for your blood pressure is a critical part, a foundational part of what we do. In public health, we don't like to miss things, so we make sure that that's available. We're also available to go out to community events if people would like us to do that. We do have mobile vans that are available that are staffed with our nurses, our community health workers, our nurse practitioners that can screen, evaluate, refer, as Dr. Soltani talked about. We really believe our role in public health is to leave no one behind. So we ensure that we are accessible. And I want to remind people that that's free. That service does not cost any money. You don't need a resource to do that. If you find yourself in a situation where you don't have a primary care provider, you don't have insurance, you think there's lots of ways that you're not going to be able to do it, please come to the clinic. We do have ways where we navigate, we take people through the system and we make sure that they can end up in a safe place that can ensure that they get appropriate care. We work closely also with Mariposa and the other clinics that are in Cochise County too. So lots of opportunities there. There's no reason for people that are seeking care to not be able to get that. So please come to the health department if that happens. Our hours are on the website. We did just open a new wonderful clinic called the Northwest Service Center off of, if you're familiar with Tucson at all, off of Miracle Mile. We have 10 new beautiful exam rooms. It's probably worth coming to visit just to see what it looks like.
Great. Thank you for that. Thank you, Dr. Soltani. Thank you, Dr. Cullen, for great presentation today. We covered a lot in 30 minutes. Blood pressure, the consequences, what we can do about it, the issues of medication, no medication, and access to healthcare. More importantly, to be able to measure it and not depend on symptoms. That's the message today. I think with that, we're going to end the the program today. I want to thank again Dr. Cullen, Dr. Soltani for joining us today. You do an outstanding job. I want to congratulate you for the work you do. I think Tucson and Pima County is such a much better place with both of you, and thank you for being great partners with Mariposa throughout the years. With
Thank you
that,
so much for inviting us. We enjoyed it very much. Appreciate it. Appreciate your viewers' time as well.
And your guidance. Yeah.
I want to thank We Love Nogales, our Facebook Live. Edgardo will send that out to you, and you use it the best way you decide. So thank you so much. We'll see you
Thank
the next
you.
time.
Bye, everybody.
Bye-bye.